Welcome back. We've had some technical difficulties, but we're back on track now with Call for Action. If you've received urgent medical care, you might have gotten hit with multiple expenses plus your bills, and it just seems like it's overwhelming.
It piles up, but there are some things that you can do to keep costs at a minimum.
Karen Stiles of our Call for Action office joins us live now in the newsroom with more.
All right, so why are we getting so many bills, and why are they so expensive?
Well, Charles, many of us think that because we are not going to an emergency room, the cost for urgent medical care will be less expensive. However, depending on where you go and the type of care you receive, you might get one bill for the doctor, another bill for lab services, and another bill from the actual place that you received care. Although you might expect all of these costs to be included in one hospital or clinic bill, many hospitals and clinics use outside doctors and labs to provide the needed care. And in some cases, even though the hospital or clinic may be considered to be in-network, these separate providers may not be. And so this could mean that you're on the hook for expensive charges because these outside providers may not have a contract with your insurer that would otherwise keep these costs at a lower contracted in-network rate.
So Karen, what can we do if we get these unexpected bills?
Well, contact the hospital or clinic and ask questions about the care you received and how they alert their patients to these types of billing arrangements. Depending upon the circumstances, you might be able to negotiate the facility fee. However, they may not be able to help with the costs from outside providers. You might also want to contact your insurer to request that they pay for these outside services at an in-network rate. However, keep in mind, if these outside providers do not have a contract with your insurer, they can charge more than what your insurer will reimburse, and you could be on the hook for the balance.
Yeah, and all this can be very time-consuming and very frustrating for those involved. How can you avoid falling into this type of situation?
Well, before you receive care, ask questions about how you will be billed. Ask your insurer about other less expensive options, such as a walk-in clinic, or for more minor ailments, you might also want to ask your insurer about coverage for convenience care clinics or televisit options. Charles and Shannon?
Well, that's good information because, Karen, I had a medical procedure done. It's sort of one of those routine things, but they said, here's a checklist of things you need to ask your insurance company. So I thought it was good. You can kind of just go through there and know that everything that's going to be done is going to be covered by insurance.
Yeah, you
Absolutely.
All right, Karen, thanks. Need help with a consumer problem or our Call for Action volunteers are available to help out? Call the number right there on your screen. We'll be right back.